Hello everybody, this is Dr. Sai Krishna Kolluru, Consultant Medical Oncologist, American Oncology Institute, Vijayawada. Today we are going to discuss about cervical cancer. Cervical cancer is the second most common cancer among Indian females following breast cancer, and it is the most common gynecological cancer among Indian women. So every year the incidence of cervical cancer has been increasing in the low and middle income countries because of the increased risk of infections like human papillomavirus. So there are certain risk factors like human papillomavirus, smoking, immunodeficiency, and then women having multiple sexual partners and also unprotected sex. These are the common risk factors for the cervical cancer. About almost 3/4 of the cervical cancers are particularly mainly due to human papillomavirus, which is a DNA virus, and women in her lifetime, almost 90% of the women will be getting this human papillomavirus. Out of that, 90 to 95% of the women are able to clear the infection in her lifetime. A human papillomavirus infection, it will take almost 10 to 15 years time to become to cause the cervical cancer. So, how we diagnose this human papillomavirus before getting into a cancer? So, there is a procedure called cervical cancer screening. So, we all know there is a test called Pap smear. It is a spatula. Using a spatula, we are doing the Pap smear test. So, women from the age group between 21 years to 65 years of age group will be tested for Pap smear testing. So, this Pap smear testing is indicated every 3 years in among women between age group of 21 to 29 years. From 29 to 65 years of age group, there are two tests. One is Pap smear testing, another one is HPV DNA testing. So, this is called co-testing. And those women who are above 65 years of age group, if they are already having 3 negative Pap smear testings, they can be avoided screening. So, coming to how can we prevent this human papillomavirus infection turning out to be a cervical cancer? So, there is a vaccination procedure called cervical cancer vaccination, where this vaccination will prevent the infections like HPV turning out to be cancers. So, there are particularly 3 types of cancer vaccines for cervical cancer. Cervical cancer screening typically should be begin from the age of 21 years. So, from the 21 years to 29 years of age group, there is a test called Pap smear testing, where we will be identifying the cervical epithelial cells and identifying the viral infection. And for the women from 29 to 65 years of age group, there are 2 tests. One is Pap smear for every 3 years, and another testing is called HPV DNA testing, where both the Pap smear and HPV DNA testing together will be done every 5 years. And for women, those who are above 65 years of age group, if they are already having 3 consecutive tests of Pap smear are negative, screening can be avoided. So we all know the prevention is better than cure. So there is a preventive strategy for cervical cancer where we can prevent the HPV infection turning out to be a cervical cancer. So for this, the cervical cancer vaccination is the main strategy to eradicate and eliminate the cervical cancer. So for vaccination against human papillomavirus includes typically 3 vaccines. One is Cervarix, another one is Gardasil, another one is Gardasil 9. Cervarix is a bivalent vaccine where it will cover only 2 serotypes of the HPV. And Gardasil is commonly used vaccination where it will be indicated for among the male and female of age group 9 to 25 years of age group at the dosage of 0, 1 and at 6 months of age group. Then, what are the typical symptoms of having cervical cancer? So, women will be frequently complaining of a foul-smelling white discharge for a long time and a persistent bleeding and postcoital bleeding and long-standing pelvic pain, and also there can be signs of advanced disease like back pain and also breathlessness. These are the common symptoms of cervical cancer. And there are 4 stages of cervical cancer. First stage is limited to cervix, second stage extending into the uterus, and third one it can extend to pelvis, and fourth stage is almost extending into the distant organs like liver, lung and bones and lymph nodes. So every stage, if you detect the cancer at the early stage, the treatment modalities will include surgery and also radiation. As the stage increases, the survival chances will keep on decreasing. So it is very important to detect all those cases at the earlier stage. So an early stage cancer can be detected actively by screening all the women in the reproductive age group, and particularly in the women 21 to 65 years of age. So you can do a biopsy, also called colposcopy, is the test procedure done for cervical cancer biopsy testing. And also there can be doing imaging with the CT scan and to diagnose the stage of the disease. So there can be treatment options like surgery or a radiotherapy or chemotherapy, and along with that there are typical treatments like targeted therapies can also be used to cure the disease of the cervical cancer. So the take home message of today's discussion is to always all the women should get informed, all the women should get vaccinated, particularly among the young women between age group of 9 to 25 years of age group, and all the women must be get vaccinated, and also all the women should get screened. Thank you.